Hey, if you're a North Carolina state employee or you have a relative or friend who's a state employee, listen up. I have the details on the changes to the health insurance plan for state employees for 2027. I'm Rose Hoban with NC Health News, and I'm standing outside the state treasurer's office where the Board of Trustees for the state health plan just voted on changes. Now, just a tiny bit of history. Last year, for the first time in 8 years, state employees had a huge increase in their health insurance premiums, but the plan did do something new. If you earn less, say you're a janitor at a state hospital, you pay less for your health insurance than if, say, you're a professor at the UNC system who pays more for health insurance because they make more money. Well, that system is staying in place this year, and prices are going up. The good news is that the increases are pretty darn modest. If you're that janitor and you have the basic plan, your premium is only going up by $1.76 a month. The most anybody's premium is going up is going to be $8.04 a month. I was hanging out last night with a friend who's on the staff at UNC, and I told her that her premium would be going up about $5 a month, and she was like, okay. So the big change employees will see is that the plan is doubling down on their preferred provider system. If you go to one of the plan's preferred providers, which is UNC Health and Novant Health, you could save big, like thousands of dollars a year. It means that you might have to drive a little bit to get to your primary care provider or go a little further for specialist visits. Tom Friedman, who heads up the state health plan, said about 80% of the people in the plan are already driving to see their providers. And Friedman also said that folks who choose preferred providers could see an overall annual spend that's less than what they were paying in 2011. How crazy is that? Now, don't get worked up if you live in a place where there's no preferred provider. If you see a doctor or a nurse practitioner or a therapist on the Access plan, for the most part, you won't pay more than you paid last year. Oh, and if you're pregnant or are having cancer treatment or are a transplant patient, or say you have a baby in the neonatal intensive care unit, they won't make you change, and you won't be charged extra, even if you're at a hospital that's a non-preferred provider. And you won't get penalized if you need emergency care either, no matter where you go, because they're not going to charge you if you have an emergency. Now, State Treasurer Brad Briner says he believes this path is the right one to getting the plan to sustainability. It preserves access to high-quality care, he said, and improves affordability for many members and puts the state health plan in a stronger, more sustainable place for the future. The other big news out of this meeting is that the insurance company that'll be administering the plan will be Blue Cross Blue Shield of North Carolina, which goes back to where things were before 2025, when Blue Cross was the administrator of the plan for decades. But really, Tom Friedman, who runs the state health plan, said the choice of who will be administering the health insurance plan will matter less because now his office is taking more control over the design of the plan and telling the insurance company to go out and do what we've planned. There's a lot more detail in a story that's on our website. I mean, a lot more detail. So check out NC Health News. As always, link in the bio.